taper. What taper is used? Taper means, see, I'll tell you what is taper. The whole and soul of
Diameter of
canal.
the file, basically nothing much.
See, if canal means, this is how the natural canals will be. In cervical third it is
Like a cone.
little bit broader. In middle one third less broader than in the cervical one third. As it approaches
Narrow in the apical side.
narrow in the apical third. This is taper. This is natural taper.
We have to follow it.
That's all. That's all. Very good. This is the natural existing taper. We have to follow that taper. From tip of the apex to the crown, if you go, the diameter increases.
Correct.
If you come from cervix orifice to apex tip, diameter decreases. That is taper. Variation in diameter is taper. Taper, if you see, it is from orifice to apex, it will decreases diameter. Apex to orifice, it will increases. That is taper. So that taper you have to follow. So what is the naturally existing taper? The simple 2%, 4% and 6%. What is this 2%? Hand files.
And file.
Traditional hand files come up with 2%. No, even today 2% rotary files are also permitted.
Glide path files.
Glide path files are
This
2%.
person come only in the rotary system.
Previously it used to come in hand files. No, also as a glide path files, they are
Somebody say this person, what is the significance?
It's a coronal diameter.
Diameter
How
person.
thickness the file is in the coronal part. Anyway,
The
the
tip
apical
of the-
part will be same.
file, there is 0.02 millimeter.
Millimeter.
Tip of this 2% file is 0.02 millimeter. Tip of 4% file is 0.02 millimeter. Tip of 0.4% file is 0.04 millimeter. This one. Tip of 6% file is
We should be always telling this percentage, why not 4
Millimeters.
millimeter.
percentage
for
for the
2, 4, 6 like that.
they have divided according to this, because the root length according to the root length
So ratio.
Ratio.
Relation.
relation, they have divided for convenience.
Correct.
6%, 4%, 2%.
Basically the thickness of the
8%.
file. 8 will be more thicker inside.
Because
Tip of the 8%, if you take the tip of the 8% file, whose diameter is
More.
more here, less compared to less here. Here, even less. Here, very less. See, this is taper. See, if you are dealing with narrow canals, 4% is standard. What are the narrow canals in endodontics, in the anatomy of the narrow canals means? Tell me the examples for this. Very good. Mandibular incisors, narrow, we get narrow canals. Then
MB2 canal. MB2 canal.
MB2 canals and buccal roots. You have mesobuccal and distobuccal canals of upper molars.
Molars. No.
In premolars too, mesial
Mesial
canal,
canals.
buccal and lingual canal of maxillary first premolar, narrow canals.
Molar also lower molar. Mesial.
Lower mesobuccal and
Mesiolingual.
mesiolingual.
Narrow canals.
Palatal canals of our upper molars, larger.
Because only one.
We have to follow this taper 6%. Larger means you have to. Distal roots of lower molars larger.
Largest.
You have to keep the taper
More.
6%.
6%.
This is the standard. If you are doing with hand files, 2% is
But there may be variation also.
depending. See, this is the standard variations also. That you diagnose yourself.
Yeah. If you
Bulbous
see that
roots
there
are-
is distal canal is 2 distal canal present, there should be narrow, and then you use 4%.
Very nice. Distal, two canals are there. Other canal is always. If their canals are divided, means the narrow.
Narrow.
4% we have to use. This is the taper. See, this taper also matters about vitality of the tooth. Vitality. What is the vitality? Relation between vitality of your tooth and your taper. The standard taper I am telling you, tooth are vital, straightforward cases.
There's
You
no
can go with this.
calcification.
If there is non-vital teeth, necrotic tooth, we have to increase our taper,
Ah,
irrespective of your anatomy. Why? You get necrotic case, severe infection, draining abscesses, chronic reinfection. Then there is chances of presence of biofilm at the apical 1/3.
ah, sir.
Then you have to increase your taper. Why to increase your taper means, what is the necessity means?
Taking the irrigating needle to the
Proper
apex.
irrigation.
Proper irrigation. Taking irrigating needle to
Apex. And
Till
using
the
endosulfan
root apex.
and proper hypo irrigation.
Means we have to widen.
Widen the canal.
widen the canal. Because if you don't widen it, then how you will take your 31 gauge needle? 31 gauge needle, if you have to go till the apex means you have to widen it.
Ah, sir.
In which case,
Necrotic.
Necrotic,
case,
severe apical
apical,
infection,
infection,
re-root canal
Root
cases,
canal cases.
where chances of presence of biofilms.
So in simple means regular
Regular is
regular in which case this normal.
Periapical abscess.
Normal.
Tooth is vital.
And tooth is vital.
Vital means
Vital.
bleeding is there means vital tooth is there. Immunity is good. There is no chance of formation of biofilm. Less chances of biofilm.
In that case, you can do normal.
Normal. 4%. If chances of biofilms are present, you have to take the irrigating needle to the
Biofilms, can you
Means-
explain?
Biofilm means it is a biofilm means it is the simple term. It is the house of the bacteria.
Bacteria. Like a plaque formation. This
It's
like.
the house of the bacteria. It is the bacteria starch. There is a starch film in
It's
that.
like in periodontics. Periodontics also.
Ah, same.
Biofilm.
Biofilm means
Yeah.
Same.
this is starch.
Like
Potent
actually-
bacteria, virulent bacteria, colony of virulent bacteria attached to your canal wall, where with normal irrigation it won't come. Needle has to go closer to it. I have to irrigate side vented needle, then only it will go. That is biofilm.
In that case, we have to widen.
Widen. There is no other way. 6% जाना ही है कोई सा भी canal. If it is okay, otherwise, because irrigation is very important.